So we now have a panel called Global Glow, and really excited to hear from all of our presenters here. And our moderator is Cindy Kelly Mays, who attended the Washington, D.C. 2017 conference, where it was wonderful to meet her. So it's equally exciting to have her now as a presenter and a moderator. And we have this great photo of Cindy, myself, Lori Weber, and David Weber at the World War II Memorial in Washington, D.C. And I just love that photo. Welcome, Cindy. We're so excited to have you.
Thank you. And that meeting was so wonderful. That was a transition in my professional life where I went to that meeting and I just saw the great things happening with retinoblastoma, and I was so excited about what you were doing, and I'm just so proud to be a part of this. And that's when I decided to reach out to Know the Glow to create global awareness for retinoblastoma and other glow-related diseases. So this whole panel is going to be about noticing the glow and how to detect the glow and just creating awareness around the glow. And I am a proud parent of a retinoblastoma survivor, detected early and luckily had wonderful outcomes. So in our presentations, we're going to have 3 speakers. We're going to have Megan Weber, who is the founder of Know the Glow. We're also going to have Dr. Andrew Blaikie from the University of St. Andrews in Scotland, talking about the arc light, having tools to detect the glow earlier, which earlier detection creates better outcomes. And Larry Wagh, Larry Wagh, who was a retinoblastoma parent in India. He's actually pursuing his PhD in nursing and works in palliative care. And he's going to talk about his experience in India, working in palliative care and being a parent of a retinoblastoma child. So Megan, please take it away and talk about your wonderful story about the glow and the inspiration. Appreciate you.
Thank you so much, Cindy. So excited to be here. Hello to everyone. It's just such an honor to be part of this. It feels like a global family reunion in many ways. So it's just wonderful to be able to present on the topic of early detection and global awareness, and really about collaborative advocacy, which I think is really what this whole conference is about. And it's definitely at the very heart of what we do. I wanted to present today. This is the first chance we've had to present with you at this conference. And for those of you who aren't familiar with the Know the Glow awareness campaign, I wanted to give you a little bit of the history about who we are, how we came to be, even though I feel like we've been walking beside you for over a decade. So it's exciting to have a chance to have this type of engagement with you. But my name is Megan Weber, and to give you a little bit of the backstory on our family, I wanted to show more about where we began. So this is my family 10 years ago now. I'm the mother of 3 children, but it's our second son, Ben, who really started us on this journey. Ben was 5 years old when we first started noticing the strange golden glow that really only showed up in photographs where we had a flash. So it wasn't in every photograph, typically only in night photos or a lot of photos around the holidays. And we never did see it without a camera's flash. But when I went on a trip with my sister one summer, every single photo that she took of Ben showed that glow in his eye. And she remembered hearing on a TV show many years ago that it could be a sign of cancer in the eye. She called and asked me if I would take the photos with me and show them to my pediatrician just to be safe. When the pediatrician looked at Ben's eye, he saw nothing. Maybe the same situation for many of you. But after I showed him the photographs, he did refer us on to a pediatric ophthalmologist for a more thorough check. And it was there when the pediatric ophthalmologist actually covered Ben's right eye. He couldn't see that letter E, the size of the full computer screen, just a few feet away. And my husband and I were completely shocked. He was 5 years old, fully verbal. He'd never complained about his vision or rubbed his eyes or run into any walls. How in the world could he have no vision in that eye? And then when they took us into the next room and they showed us the scan of the mass in the interior of his eye, which was causing that glow to reflect back, they believed it to be retinoblastoma. We were immediately sent to Children's Hospital in Los Angeles, where we were met by 2 amazing doctors, Dr. Lynn Murphy, who actually initially gave us the phrase "know about the glow," and Dr. Tom Lee, experts in both retinoblastoma and something I'd not yet heard of at the time, Coates disease, a disease where the blood vessels leak fluid into the eye, which collects and separates the retina over time. While my husband and I were in a daze that is likely familiar to many of you, these doctors would then work to find Ben's diagnosis. Ultimately, it was determined that Ben has advanced stage Coates disease. And while not retinoblastoma, Coates is another lifelong condition which can lead to the removal of the eye if not caught in time. He's lost most of the vision in his left eye. He's been through multiple laser surgeries and patching programs, and he'll be checked every 6 months forever. But he's managed through beautifully. And if you fast forward now to Ben today, he's a teenager, he's a senior in high school, he plays sports, he drives, and he's never let his vision impairment stand in his way. After his diagnosis, though, we were left with so many questions, and we met so many families. Mainly, how did we not know that this glow was something to watch for? And what if this had been retinoblastoma and he'd lost his eye or even his life due to lack of awareness? When we started to work with the doctors and learn more about the over 20 different conditions that the glow called leukocoria can represent, and that glow is often the only sign, or as Swati mentioned, 75% of the time it is the referring sign for RP, we knew more needed to be done. When we found that 80% of the time it is parents or family who are first finding that glow, and that 80% of the time childhood blindness is treatable or even curable if caught in time, we knew we needed to take action. And so, surrounded by family and other motivated parents, Know the Glow was born. We're an awareness campaign aimed at sharing the message of the dangers of the glow through our website, through PSAs that show who helped first find their family's glow, and through other co-branded ad campaigns where we hoped initially to find just one child in the US with either Coates disease or retinoblastoma. We did hear from families, many passionate about sharing their stories and sharing the message. One mother even tattooing Know the Glow in a ribbon on her arm. We knew we were making an impact. And as we began hearing from parents and families all over the world, sometimes from countries we'd never even heard of, who were asking to share their story or to start a chapter in their country or to ask for help in finding answers, we started to open our eyes to the bigger world. One day, when a Google alert showed this article about a childhood cancer awareness parade that was happening in Mumbai, we zoomed in and saw that not only were they borrowing phrases from our website and messaging, but they had even written Know the Glow in that back sign by hand. And we knew we could give them better materials to help create a better way to share the message of awareness. So our global outreach program began. We are a team of volunteers, and we've partnered worldwide, but especially here in the US with students and faculty from the University of Notre Dame, where they began to reach out to doctors and NGOs in other countries. Our creative media team started to develop infographics with just the short, simple phrases and hopeful faces of children who would better reflect the countries where we sought to engage. With local volunteers translating phrases and pictures, which do speak 1,000 words, we hope to turn awareness into action and to reach out through social media and traditional marketing channels to build awareness abroad. We've developed a process of creating campaigns in countries, first by meeting the incredible families. They're amazing doctors like Dr. Chow and Dr. Blaikie, the hospitals, the NGOs, learning about the country, their practices, their outreach, connecting the dots and highlighting their work and building bridges each step of the way. We've often said you can't treat them if you can't find them. And with Know the Glow, we really hope to offer more ways for doctors and NGOs to do what they're already doing even better, hoping that through awareness, education, and early detection, we can help families find their way to local resources and stop these diseases in their tracks. Recognizing that the majority of visually impaired people live in Asia and Africa, and how large the challenge is there. And especially recognizing that around the world, that 0 to 5 age group is not only the most often overlooked for eye care and screening, but also the most urgent to find for retinoblastoma. We believe that the #1 way to impact childhood blindness is through early detection. And we know how imperative it is to advocate for those who are still waiting to be found. For every parent who reaches out to us, there are probably hundreds more who will not know how to find answers or even know what questions to ask. And we also know we can't do it alone. It does no good to alert people to a problem without having a plan in place to support them. And so by linking arms with other like-minded organizations, other amazing doctors, incredible NGOs, we hope to ensure that these children can find their way on a supported journey from the moment of detection to diagnosis, through treatment, all the way to aftercare. We're always looking to jointly build a bigger megaphone, to educate healthcare workers, empower families, provide information that can help them overcome fear and prevent potentially devastating blindness and even needless loss of life, all through simple awareness. Together, we can help make the path straighter and shorter and the future brighter for tomorrow's children with retinoblastoma, all through 3 little words, a photograph, and a team ready and willing to turn adversity into advocacy and advocacy into action. Today, you'll hear from Larry Wagh and from Andrew Blaikie, and they are perfect examples of how we can build a bigger support system through networking with each other to share best practices, learning about what's happening in Brazil, later learning about the work that Dr. Fabian is doing. There are so many things that we can do better if we do it together. So I'm so grateful for the chance to be here with you today. So excited about this conference and so honored to speak with all of you who are raising children or who are survivors yourself of retinoblastoma. Thank you.
Thank you so much, Megan. And next we have Dr. Andrew Blaikie from the University of St. Andrews and his new opportunities for catching the glow earlier. Thank you, Dr. Blaikie.
So good evening, morning, lunchtime. I don't know where everyone is. It's certainly evening time here in Scotland. I'm an ophthalmologist and I'm very grateful for the invitation to this amazing meeting, and thanks to Megan for being such a wonderful advocate of the ArcLight device and the ArcLight project. So as I say, I'm an ophthalmologist. I work half the time in the government healthcare system in Scotland and half the time with the University of St. Andrews in our global health team. And my motivation and my interest is very much driven by what I term, or many people term, the inverse care law. And these world maps are drawn and the countries are drawn related to a metric related to something. And at the top, they're drawn in relation to the burden of disease, in this case, the burden of blindness. And at the bottom, the size of the countries are drawn in proportion to how many doctors there are and how much diagnostic equipment is available in these countries. And as you can see, there's this inverse care law. The areas with the greatest need have the least access to healthcare resources. One of the reasons for that is difficulty in accessing diagnostic tools. And there are many barriers to accessing diagnostic tools in low resource countries. They can be expensive, they need replacement batteries and bulbs, which themselves can be expensive and hard to find. Devices are often over-engineered, unnecessarily elaborate, and easily broken. Often they're quite heavy and bulky, and you need to plug them into the wall for them to work. And all these reasons mean they're not very good for low resource settings. And not having a diagnostic device and not having, for instance, a direct ophthalmoscope to look into the back of the eye to diagnose retinoblastoma is one of the big reasons that retinoblastoma presents late in lower and middle income countries, and for that matter, in wealthy countries as well. Well, I work with this gentleman here, William J. Williams, who's a very talented optometrist, who's also a designer and electronics expert. And we've looked at all these different barriers and come up with some solutions. And this has led to us developing the ArcLight device at the University of St. Andrews over the last 10 years or so, originally funded by quite a large grant from the Fred Hollows Foundation, which is a large eye care charity based in Australia and New Zealand. And this is the evolution of the device over the last 10 years or so. The big difference between the ArcLight device and a traditional direct ophthalmoscope design is that we don't have any filament bulb in the arc light, and we don't have to have the filament bulb below the optics at the top here coming off a mirror, making it kind of bulky and a bit over-engineered. Instead, have a little LED light at the front of the device, which the examiner can look through a hole over the top of the light straight into the back of the eye. In the same way as you get that glow when you take a flashlight camera of a child, the lens of the camera and the flash of the camera are actually very close together. Especially the further you go back, they subtend a smaller angle. And that's basically what all a direct ophthalmoscope is, a bright light with a sight hole over the top by the light. So there's many studies have been done now comparing the arc light device with traditional direct ophthalmoscopes and published in a number of different journals. And they all confirm that the device is just as effective at diagnosing eye diseases such as glaucoma, diabetic retinopathy, but importantly, the fundal reflex abnormalities that are associated with conditions such as retinoblastoma and congenital cataract. But more than that, the device is actually easier to use. And despite its small size and frugal design and low cost, it's just as effective as these more expensive traditional devices. Studies from Malawi have confirmed that the device is just as effective as traditional devices. Other studies from Malawi looking particularly at fundal reflex abnormalities amongst primary and mid-level workers were able to use this device to identify very, very accurately a normal and abnormal fundal reflexes. A large study from India recently also showing the same outcomes, and you can identify these different fundal reflex abnormalities to identify a whole range of diseases, not even just cataract and retinoblastoma, but squint and refractive error as well. And more recently, my colleague Fuharini in northern Tanzania has performed a very big study in the community with primary eye care nurses in the community, showing that the sensitivity and specificity of the arc light device is excellent compared to other more traditional and expensive tools. To support implementation of the arc light device, we have developed simulation eyes to help train primary and mid-level workers in lower resource countries. And for instance, these tools can be used to demonstrate the fundal reflex abnormalities. And the video at the top of the screen there is going through the different fundal reflex abnormalities that can be demonstrated on the simulation tools. And so we can train primary and mid-level healthcare workers with the arc light device and with these simulation tools to understand what normal and abnormal reflexes look like, so as they can then refer a child earlier for assessment at a specialist eye care center for the assessment of any cataract or retinoblastoma. You probably noticed that I've not used the term red reflex in my talk yet. I'm not a fan of red reflex. I think it should be called the fundal reflex. This is for some pretty good fundamental reasons. There's a process underway in universities and in the medical literature in the UK called decolonizing the language. And this stems from historically all language related to medical education relating to white European people. And this is a big deal in the dermatology at the moment, and is very relevant to try to diagnose signs of anemia, cyanosis, and jaundice in people who are not white, because the clinical signs look different in people who have more pigmented skin. And the language we use to describe these signs is important. So, for instance, in the red reflex, the red reflex really is only red in white European people, and even then, it's not really red. It's actually kind of orange and yellow. In Asian people, it tends to be quite kind of yellow and sometimes white. And in African babies, it can be white and sometimes having a tinge of blue coming back. So it doesn't look red at all. And I know from experience trying to teach and train people how to do this test in Africa, they say this is abnormal in a normal because we're calling it the red reflex. So personally, I prefer to call it the fundal reflex. The light is bouncing off the fundus at the back of the eye. And so the fundal reflex is a more appropriate term for teaching, particularly in countries where the children are not white. You can find our teaching videos online just by typing in red reflex or fundal reflex. I had to have red reflex there, otherwise you wouldn't be able to find it. At the moment, it's sitting fourth in the kind of Google search terms, and you'll find these videos how to use the ArcLight device to then perform the fundal reflex and perform an examination using the device. The fundal reflex is easily seen using the ArcLight device. In this baby here, I've videoed this baby's fundal reflex examination by attaching the ArcLight device to a phone and taking the video. And you can see there in this white European Scottish baby that their red reflex is not red. It actually varies a lot between orange and yellow as you go through the examination. And in a black baby, it looks white, with kind of blue and green reflections coming from the back of the eye. And this is normal. This is a normal red reflex examination. Obviously, as I said before, the red reflex examination, the fundal reflex examination, can identify squint, refractive error, partial cataract, complete cataract. And all these images here have been taken with the ArcLight attached to a phone and are part of the online videos available on YouTube. We've developed a teaching package. We're an interprofessional education teaching package involving nurses, optometrists, orthoptists, ophthalmic clinical officers, and doctors in Rwanda, and we're rolling that out amongst the university there, using our simulation tools and equipping individuals with the ArcLight device, which costs roughly 10 to 12 British pounds, compared to the hundreds of pounds for a traditional direct ophthalmoscope. And we can train people on these simulation eyes, and then afterwards we can assess them to see whether they actually understand what a normal and abnormal fundal reflex looks like. And this now has been adopted in many different countries of the world by a whole range of different NGOs. And as I said, you can attach the ArcLight device to a phone, so you can acquire video and images of the fundal reflex, which can then be used using telemedicine apps such as the vCreate, which is a team we're working with at the moment in the UK and hope to work with in Uganda in the near future. So the ArcLight device and the training tools are a low cost yet effective means to perform the fundal reflex test. There's some simulation tools to support the training, as well as online videos to reinforce the face-to-face teaching. You can attach the camera to a mobile phone, and this offers opportunity for remote second opinions to reinforce training and to document the clinical findings. And overall, we like to think the ArcLight project is helping earlier diagnosis for better outcomes. Thank you very much.
Thank you so much, Dr. Blaikie. And now we are going to have Larry Wagh present, retinoblastoma father and PhD candidate from India. Thank you, Larry.
Great. Thank you so much, Cindy, and especially thank you, Megan, and the team at One RV World. I have Abigail with me, and I'm going to share her story. Great to be here and interact with everyone and get to learn something new again. So today I'm going to share with you a story of Abigail and how things have changed since we have identified her with retinoblastoma. She was diagnosed on 23rd of May, and it was amongst the most crucial situation or a critical situation in India when we were going through the pandemic and we were in complete lockdown. Although we were being referred to a hospital which was over 350 miles away, and it was termed as it is the only hospital that will treat retinoblastoma. We could not lose hope, and we were soon to identify that there was treatment available in less than 100 miles away. That was in Mumbai city. And that's where we realized that there is the stigma of retinoblastoma in India, that it is a very rare cancer. It is something that cannot be treated early, or it is where your child cannot survive. Abigail, in her treatment, underwent 6 cycles of chemotherapy at Baijarbai Wadi Hospital in Mumbai under Dr. Sangeeta Mudlayar, and she underwent repeated EUAs, cryotherapies, and finally underwent enucleation of her left eye at NHSRCC Hospital in Mumbai, which was performed by Dr. Himika Gupta. And then she had an ocular prosthesis made by Dr. Madhulata. As parents, me and Divyani have experienced the pain and suffering of not just our daughter, but also of those parents of children that did not make it. And that was where we thought to step up and create difference. We are now on a mission to ensure that her story and her testimony reaches out to everyone. And that will not just give us the glimmer of hope for the child, but also help to save the child's sight and also save this child's life. This is our hope. With that, as me being a nurse myself and pursuing my PhD, I thought that there is a need for training others, especially related to retinoblastoma. And if it goes undetected, we all know the situation at the end. So we began community awareness with our first radio podcast and a radio program at the famous 94.3 Radio 1, followed by several podcast channels. Looking at another need that we need to step out there and we need to educate the nurses, the optometrists, and the doctors, we conducted various webinars. One of our webinars was for the doctors on the 13th of September, followed by a webinar on World Sight Day, which brought in over 400 nurses and optometrists from all over the world, and we could create an impact on educating them about eye problems, especially in children, as well as retinoblastoma. Looking at the need that we need to develop more training programs, I was happy to interact with Megan from Know the Glow, and we developed a small team, and we started working on key areas, that is awareness, screening, the white eye reflex, on low vision management, as well as prosthesis, and we call ourselves Focus Vision 5. And we've been working very actively in India towards ensuring that no child is left unscreened, and that no child is unreferred to treatment, and that child should be saved at all times. Looking at that, again, I was so happy with Marissa when I interacted with her last August, and I saw that there were support groups available, and I was happily welcomed with the support group in California. And looking at the need in India, I thought of starting a support group in India, and we created a group of RB survivors, and we initiated a survivors meet. We are so happy to announce that we've had 2 survivors meet till date, and we have over 25 to 30 families that are receiving counseling. They are receiving, have their answers question on genetic factors, and there are also many talents that have been identified of these children, and they're getting blessed by our presence. With that, I would want to thank everyone that has been supporting us, and we wish to receive your support throughout our mission, that is ensuring that every child is saved, every child's glow is detected, and every child receives the best care that's required. Thank you.
Thank you so much, Larry. Really love seeing Abigail there. I do have a question. I think this is for Dr. Blaikie. What are the barriers for distribution? Is the device being widely accepted within the frontline medical community?
Yeah, that's a good question. So there are over 30,000 ArcLight devices distributed throughout low and middle income countries throughout the world. The adoption has been very straightforward by primary and mid-level workers, because many of them don't really know what a traditional device looks like. And so they're quite happy to accept the ArcLight device. Unfortunately, it's not the case amongst ophthalmologists who look upon it as a bit of a toy and not a real ophthalmologist, or not a real direct ophthalmoscope, even though all the studies show it's just as good, if not better, easier to use and cheaper. So it's adopted very, very well amongst the primary mid-level workers, but a bit of reticence amongst ophthalmologists.
Sorry about that. I could just see it working in, tribal areas where there's no medical care. If they're going in for vaccination, they can maybe screen for the red reflex, which would be wonderful, catching any glow disease. Yeah,
of course. I mean, the device only weighs 18 grams. It's only 10 centimeters long, 8 millimeters wide. It doesn't require replacement bulbs or replacement batteries. It's solar powered with an LED. It just continues working through ambient light being charged through walking about with it around your neck. I've never charged my device. It just charges itself. So, and it's completely indestructible. You can drop it in a muddy puddle and give it a wash down. You could run a car over it. It's an absolute no-brainer.
Can I ask a quick question? Andrew, a great presentations, everybody. But Andrew, just a quick question. As an orthoptist, I understand the difference between the direct ophthalmoscope, and I can't wait to see the arc light. What's it like on newborns? We know newborns are notoriously difficult to get a good red reflex or fundal reflex, and I agree with you entirely. We do need to change the terminology. How does it, what sort of image does it give you on that newborn?
Yeah, sure. So you've got to kind of hit a balance. There are three settings on the light, and so you can kick off with the lowest setting, and then if you're not seeing very much, it's making the not getting much of a reflection, you can click onto the next setting, get a bit higher, and obviously it's trade-offs between making the pupil constrict and getting that reflection back from the fundus. So you can go to the third click as well and get the really bright light. There's also actually when you go to this end, it kind of flashes in blue and white. And it's very good for getting baby's attention. Maybe not the newborn in the first week, but certainly kind of the 6 to 8 week child. If you start flashing this around, they kind of know what's going on, and then you can turn it around, and then you can suddenly put on the direct ophthalmoscope end. So it's a good question. We've not done any proper evaluation work in newborns. It's the best study would really be Fuharini's from Tanzania, whereby they say community healthcare workers used it in their general pediatric and development clinics. So the children were of different ages. And you saw in the video that child was 4 or 5 months in the video, and as you know, that age they love looking at lights and they're interested if you dim it. But I accept that in newborns it is a greater challenge and is trickier,
Okay,
which is why it needs done at day 1, and then in the UK they recommend 6 weeks, and then ideally at all other kind of interventions where the healthcare system interacts with the child thereafter. And immunization programs are the obvious point to get involved with in India and in Asia and Africa, because they just hit the right times where you might pick up a retinoblastoma.
Yeah, perfect. Thank you.
And I think one more question for Megan. Can you speak more about collaborative advocacy and how you've expanded your reach across the world, and how people carry each other through this journey of retinoblastoma, of Coates, or other glow diseases?
Yeah, I think, it's just like today, as we're learning, it's like these doctors are learning from other doctors, and whether it's hearing about Dr. Chow and how she was able to train with Dr. Blaikie and then bring that home and change the course of the country with her medical treatment options, or Larry and what he's creating in terms of survivorship models and seminars and meetups, as he's learned through other Facebook groups or seen, and then converted into webinars to help then take it to his medical training, and working not only in with medical students, but then even all the way to palliative care, where you see a whole different set of individuals who are very anxious for us to work collectively on how to go all the way back to early detection, but all the way through to helping to care for these children and make sure that it is universally accessible, which is where Andrew's tool is so key in giving us that extension, that outreach. You see children who find their way even to Dr. Chow from the outlying regions. It's like, how in the world are they getting there, and who's out there able to screen them? And with organizations like Orbis, there's so many different pieces that are working on their own little channel, but if we can do more to bring them all together under a more united umbrella. And I was speaking yesterday to Jissa James, who's with the IAPB, which by the way has approved the ArcLight scope as a medical device too. But the IAPB is now they're done with Vision 2020, they're doing their Vision 2030 insights, and it's all about elevate, integrate, and activate. Those are their 3 words, which is exactly what we're all looking to do. Elevate retinoblastoma out of the rare disease category, find a way to make it of interest and important, and powerful as a message for more countries and for more doctors and pediatricians. And then to kind of integrate all of those different pieces together so that collectively we can do more to activate and to follow in the footsteps of the countries that are doing such great work. As Vivian was sharing with what's happening in Brazil is extraordinary. I'm excited to learn more about that. And then to lead ultimately to share the stories of individuals like Leonia, who are just extraordinary, to be examples of survivors and see how children can not only come through this, but really flourish on the other end of this diagnosis. So, thank you.
Great. We have another question from Ashwin Malapatya. I'm sure I'm not saying that correctly, but does the ArcLight have FDA and or EC approvals? I think that's for Dr. Blaikie.
Yeah. So the ArcLight has full equivalent of CE approval. Because of Brexit now, we've got now a UK version of it as well. The CE approval it's only it's a class 1 device. It doesn't measure anything. It's just a light. And so it doesn't necessarily require any kind of medical sign-off. It's not available, unfortunately, yet in the USA because more of tax reasons, and we can't import directly into the USA. Saying that, people have bought them from America, but then sent them directly to their programs, say in Central or South America. Yeah, so it's got full CE approval. It's a class 1 device. It's just a little LED with a hole. I mean, it is literally a hole. There are a few lenses which run over the top of it, but personally, I never use them. So there's no reflections from it. It doesn't gather any dust, doesn't get scratched, which are the limitations of many traditional devices. It's just a hole with an LED. That's all a direct ophthalmoscope is. That's all it's been for 150 years since they were first invented. The manufacturers pretend otherwise, but it's just a hole with a light.
Okay, great. We have a question for Larry. Everybody's thanking you for your inspiration for many of us. Any suggestions for connecting with other parents and survivors?
Yes, thank you so much for that. So many parents are at a stage where they are not sure what are the outcomes. And especially when we talk about retinoblastoma, there are very good outcomes, there are good survival rates, and the chance of secondary cancer again is very minimal. So when I talk to parents, especially new ones who are undergoing treatment, it is best that we talk about the outcomes or talk about the benefits that the child is going to be having throughout the treatment. It is not just the loss that the child is going to go through, but also the positives that the child has. And that is how we connect with the families and connect with different people around the world.
Thank you, Larry. And I think one more question. What one thing, I think this is for the whole panel, what one thing would help you most in your work with advocacy and awareness or early detection? You could just pick one thing out of everything. What would you come up with?
Megan, would you go first?
For me, it would probably be more volunteers, more help, more support. I mean, we are literally drinking through a fire hose constantly. There is so much need out there. There's so much that can be done. We're all stretched so thin, and it's part of why we started Know the Glow is that I knew our RB family friends, if they were in active treatment, didn't have the bandwidth to pick up and do it. And for every parent like Larry, who's extraordinary, I'm always amazed at the parents that we meet, because I'm like, how God knew what he's doing. This child is with the perfect family to guide them through. But then I realize it's these strong parents that are navigating through to find their way to resources. And for every Larry, how many parents are never going to find that voice? And so there's so much more we could accomplish if we're able to come together. And I'm just astounded at the potential that's out there, especially now. If there's one thing that came out of COVID as a positive, it is this type of Zoom connection that we have now that makes our relationship so much more personal, even across the world, and gives us that opportunity not only to communicate, but through programs like what Andrew is sharing, or through what we just saw in the Orbis plane, where they're providing telemedicine ability to really train and educate and build that awareness globally. So I would say just more people jumping on board who are anxious and passionate about trying to prevent childhood blindness globally.
Great. And we, if anybody's open to volunteering with Know the Glow, please message us and let us know. We're always looking for volunteers. And we just so appreciate the time and attention of everybody. And just remember to know the glow. And if you see something, say something.